for the online joiners. So my name is Chiara Cosentino, and I work at the International Planned Parenthood Federation European Network as coordinator of the Countdown 2030 Europe Consortium. We are a consortium of 15 NGOs working in 14 countries plus the European Union, and our main aim is to improve policies and increase funding for SRHR of those donor governments in their external action. And I have the honor of moderating this amazing panel today for this extremely urgent topic that we are talking about. I don't need to tell you that this is a pivotal moment and that we are meeting really at a time of great transformation, disruption, and instability. The global financial landscape, including for SRHR, is shifting very rapidly due to economic instability, crisis, anti-rights actors gaining power, donors' self-interests, and defense expenditures on the rise, and which all contribute to, of course, funding for SRHR being under threat. But we deeply believe that actually in every crisis there is the seed for transformation. And if we really seize this moment and dare to reimagine a future that is brighter, even the darkest moments can be catalyzing for positive change. This is really not just a money issue, it's really a justice issue. For every dollar that is not spent on SRHR, we know that services are closing. When services are closing, the most marginalized gets always as first left behind. So I think it is really an imperative for us in the sector to think bigger, think broader. We cannot afford to continuing to do business as usual. We really need to shake ourselves, get out of our comfort zones, and think of any innovative, sustainable solutions to fund this important agenda in a system, in a new system that is grounded in justice and in solidarity. So I think the discussion today, what we want to talk about is how can we unlock sustainable financing models for SRHR in a world where the traditional fundings are shrinking. So I think this is a crucial question that we are talking about in this very pivotal moment. So our goal today is to, it's threefold, is to examine the potential, transformative potential of innovative financing for SRHR, providing practical tools and knowledge to equip us as advocates, but also decision makers, to make sure that we have sustainable and diversified funding for SRHR, and then showcase also real-world examples on how this can happen. This is possible, we just need to put ourselves in the mindset to do that. So, without further ado, I have an exceptional lineup of speakers today. So I will, and they will share insights on research, advocacy, and implementation of programs. So the first will be Federica Signorello, and she will unpack, I will introduce them when they speak, but she will unpack the complex world of innovative financing models and what they mean for SRHR. Then we will have Alessandra Nilo, and she will explore the potential of financial transaction taxes as a predictable funding source, building on the advocacy that Gestos, which is the Brazilian IPPF collaborative partner, has been doing over the past 15 years. Then we will have, unfortunately, only through video, because she was not allowed to travel to Bogotá, but we will hear from Stella Wairimo Bozire on her latest research on debt to wealth and debt for gender equality swaps, and how we could reimagine sovereign debt through a feminist lens. And last but not least, we will hear from Dr. Jan Lacayo, and he will share lessons learned from the UNFPA Smart Advocacy approach to equip national stakeholders to effectively engage decision makers in mobilizing domestic resources to family planning commodities in 19 African countries. So, let's dive in. I will introduce Federica. So, Federica, you are the advocacy advisor for financing for development and SRHR at the International Planned Parenthood Federation. You're a passionate feminist activist for SRHR, specialized in advocacy for health and economic justice. You bring many years of experience in the sector, and in your current role, you are advising and supporting IPPF member associations with all concerning financing trends, policies and mechanisms in the financial space, coordinating research and policy analysis and advocacy actions. So, Federica, I will pose you the first question, which gets us really at the heart of today's discussion. Could you walk us a bit through the latest report that we've been publishing with Countdown 2030 Europe on innovative financing mechanisms for SRHR and on the 5 models that were identified? And can you also talk a bit about what is our role as SRHR advocates to improve such funding models and in a way that they are taking into account the community's needs? Thank you.
Thank you so much, Chiara. Thanks everyone for joining us today. It's a great honor to be here and to address this audience today and to talk about this topic. So as we look for more sustainable and effective ways to fund SRHR initiatives, the concept of innovative financing really becomes increasingly important and critical. But for us as advocates, the question is, do we as advocates know what really means in practice, what innovative financing really mean in practice, and how can these tools help us overcome the persistent challenges in SRHR funding? So at Countdown, we've embarked on this journey, coming with a lot of curiosity, willingness to learn, and trying to involve other advocates who are also willing to learn about innovative financing models. Obviously, there are some challenges and limitations, and we do acknowledge that is a complex, or it might sound like a complex topic, but we also believe in exploring its potential. So here in the slide, I'm showing the cover and the QR code of the 2 latest research produced by Countdown that are relevant to this topic. To the right, we'll start very briefly with this one. Is in the latest report we produce on UNFPA supplies partnership. Obviously, I'm not going to go into the details of that one, but I just wanted to share with you, and Jan obviously will tell us a little bit more about that. And then on the other side, we have the Unlocking the Future of SRHR, Navigating the Complex World of Innovative Financing Models. That's the main report, and that's what I'm going to focus on today. So we know that this is a moment to really rethink our approach to cooperation and to funding to SRHR specifically. And we feel like we need an approach that is grounded to inequity, transparency, and mutual accountability, but also in a new system that must recognize and support the leadership of global majority and really actively address systemic imbalances. As Chiara was saying before, we also have to be honest about the landscape we are in. ODA is drastically decreasing. I'm not going to go into details of that because we heard plenty, I guess. So this is why, while we continue to advocate for ODA and more traditional funding flows to our governments, we can no longer afford to ignore additional financing mechanisms to complement ODA. So it's not about whether we do that, it's about how we do that. Oh, sorry. Okay, very quickly on the report's objectives. So sorry, I forgot to show you, the report is this one, so you also have it on the table. The report really is meant to be an easy to use and accessible tool for advocates to better understand some selected innovative financing models, really explore their applicability to SRHR. We're looking at models that could potentially improve efficiency and accountability in how SRHR programs are financed. Obviously, they contain practical examples, so each of the selected models, on top of having an explanation of how they work, etc., we also provide practical examples and best practices. And also, last but not least, we try to do that and to assess and analyze these models from a gender inclusion and decoloniality lens. So the choice of these models was informed by several factors. Each of the models, each of the mechanisms really tries to address in an innovative way a problem in the current traditional funding landscape. Here on the slide, I'm showing the sort of like top lines assessment criteria that we've used to assess slash categorize, let's say, these models. So we have, instruments funder owners, so really try to identify who is the owner of the model. We're talking about governments, donors, private sector, who are the main actors behind it. Obviously, we can see efficiency, scalability, financial sustainability, the potential for impact. Each one of these tries to answer some questions. These are quite a few questions. So again, I will invite you to have a look at the report where you have a more extensive sort of like overview of the questions that the research question that we've selected. But also, most importantly, we have the community involvement, so really understand to what extent does the model involve diverse stakeholders, such as communities, beneficiaries in the decision-making process. And as I say also before, inclusion, equity, and decoloniality. So answering the question of, does the model ensure that vulnerable and undeserved population have access to financing or its benefits? Does the model shift the power structures and prioritize community-led participatory governance? Does the model adopt a right-based approach in its implementation? So what are the models that we selected? These are the 5. You can see them on the slides. Obviously, we couldn't, there are so many out there, so we had to make a selection. So we have debt-to-health swaps, developing impact bonds, volume guarantee, crowdfunding, and taxation. I will try to use the simplest language here because that's, our intention is also to use this session to kind of like share some knowledge and some basic concept about some of these models. So for instance, on debt-to-health swaps, we will have a dedicated presentation from Stella later on. But we know that essentially debt-to-health, the ideas for debt-to-health is to boost domestic health financing by convert debt repayments into investment in public health. Obviously, it's important to mention, and I think this is one of the main messages that we want to sort of like provide as well. We see that as a short-term solution, while the long-term solution is always debt cancellation, which remains a vital long-term objective, in pursuing global economic justice. Volume guarantees, very briefly, those are an agreement between a manufacturer that mitigate risk associated with the variability, with the variation of the demand coming from the market. And so in the case of the committed volume in volume guarantees should not be purchased within the agreed time frame. Guarantors, compensate for that shortfall. Development impact bonds, this is an agreement between private investors and donors, government groups who share the same development goals. This can be considered as outcome-based models, and the investors give money upfront to support projects that work towards this goal and earns a return, if the product succeeds. We have TICO here. I've seen the booths. I think it was on the 3rd floor, and they're a great organization. We've used their in their hands project as one of the examples, so you can find out more in the report. We also talk about taxation. Alessandra will tell us a little bit more about specific type, but we're talking about new and unconventional forms of taxation. And in the report, we also talk about the example of Guatemala that, as we know, we heard quite a lot talking about it in ICFP in general. And then lastly, crowdfunding. I know this might sound like a very innovative tool, but we're looking at it from the point of view of investors who can, from an equity-based sort of like return. So the investors who decide to invest in a social impact cause can actually get a return from their investment. So I will move on to my reflections. Again, we're not focusing on the models as much, so on the technical part, but more on the consideration and the learnings that we've sort of come up with in the discussions that we've had on this report in the last few months. So engaging with innovative financing mechanisms doesn't really mean abandoning more traditional funding streams like ODA. I think what we're trying to do is also to reshape this narrative, this dichotomy, that ODA versus innovative financing. So instead of reinforce this, it's either or. I think let's focus on how both can evolve to become more equal, more inclusive, and more just, We also know that European donors, so Countdown obviously has a European focus, and I'm talking about European donors because that's our main focus, but that applies to other donors as well. They're already often distributing funding in alternative, using these tools, these models, and have been engaging in some of these financial instruments for a long time. So SRHR have been probably excluded from this conversation, and so must not be excluded anymore. So let's acknowledge that. Also, this is not about endorsing some of these or one of these mechanisms. It's about ensuring that we as advocates for SRHR are part of that conversation. And then my last slide, we don't need to be an expert to be part of this conversation. I think we've discussed this a few times with Alessandra. I feel there is a bit of a fear of engaging or like looking at the innovative financing as this big, scary, topic. And of course, there is capacity that needs to be built. I was in Madrid last month to attend the Financing Feminist Future Conference. It's always mouthful, that title. And there was a clear need from feminist activists to build capacity and strengthen capacity on this specific area. And then lastly, advancing SRHR and rights to innovative financing really requires collective action. So really not trying to not work in silos. And I'm talking about, technical experts and advocates, but also advocates, so organizations and organizations. There are some organizations, perhaps not SRHR organizations, that are already engaging in this area. So how can we reach out to them and start building partnership to learn more about that?
Thank you. Thank you so much, Federica. Follow-up question. How would you say would be the main challenge and the main opportunity of these mechanisms that you just shared?
Thanks, Chiara. So on the slide, we have a lot more of what I'm talking about, so don't be scared. So debt-to-wealth swaps, for instance, obviously, they probably provide an opportunity in the short term, as we said. But again, it's a short-term solution, and the risk and the challenge with that is that it might perpetuate some of those power imbalances between creditor and debtor nations. So we really need to be careful about that, but also in terms of the limited involvement of grassroots civil society in the decision of how some of these tools are designed. I think that is also another element to take into account. For volume guarantees, I think the challenge is about the fact that it might override, a right-based approach to family planning. So if the manufacturers and the investor decide to have one specific product in the market, what about the other one? So how is this choice made? Is it made taking all the needs into account? Development impact bonds, obviously, they've been used a lot, as I said, well, not a lot, but they've been used in SRHR. But a challenge in that sort of context could be that there is a risk of, that the project or the outcome, it'll become really all just about the outcome, right? So we ignore broader social barriers such as discrimination, poverty, and the impact that could have on SRHR services. I will very briefly go over some recommendations, if you allow me. So I'll try to condense these into 4 recommendations. So as advocates for SRHR, we urge to ensure that innovative financing mechanisms really uphold inclusive, right-based outcomes, not just financial performance. So really make sure that we not reduce the SRHR to narrow output-based indicator while implementing these models. Secondly, we need to encourage early and continuous engagement with civil society throughout the design and implementation of financing mechanisms. Too often, we are brought in only after the decisions are made, and their insights are critical to understand the community needs, anticipating risk, etc. So involving civil society is not just a good practice, it's the smart thing to do, right? Third, we really recommend an investing partnership, as I said before, that bridge the technical and the programmatic divide. We as SRHR advocate, we have the knowledge and the expertise. We know what the needs are. Some of the technical people, technical actors may design these mechanisms without taking that into account. So I think that is quite key. And then lastly, we call for greater transparency on how innovative financing mechanisms are used to support SRHR. So at the moment, it's really difficult to map out where and what each donor has done so far. And for instance, a countdown as a sort of follow-up to this report, we are actually working to map out what the European donors that we focus on, how they've engaged, what sort of these tools they have implemented so far. Thank you.
Thank you so much. Thank you for stressing also the fact that this is not a silver bullet and this is not alternative to traditional financing mechanism. I think that that's very important, and yeah, thanks for the analysis, critical analysis with equity lens. So great, thank you so much. Yes, I'm now turning to Alessandra. I will introduce her. Alessandra Nilo is a feminist journalist and filmmaker specialized in health and postgraduated in diplomacy and trade, recognized SDG expert. She currently serves as the External Relations Director for IPPF Americas and the Caribbean and is co-founder of Gestus. She's award-winning human rights and sexual rights advocate, and in 2011, she created the Financial Transaction Taxes campaign in Brazil. Her strategic influence includes serving as C20 Sherpa during the Brazil 2024 G20 presidency and leveraging her decade-plus engagement in financing for development debates to advance politics with particular focus on health and sexual and reproductive health and rights. So, Alessandra, thank you so much for your leadership in this field and also for allowing us to learn from it. And I think your presence here is particularly important as we are in Colombia and Latin America for ICFP, and I think this continent and this region can really teach us a lot. So I'm very, very glad that, that you can be on the panel with us. So my first question to you is around the potential of financial transaction taxes and around how, even when set at a fraction of a percent, your work shows actually that they could generate massive revenues streams, able to fill the gaps in SRHR financing. So yet these mechanisms remain politically underutilized. And so what will it take to move financial transaction taxes from a civil society asks to a political and policy reality for SRHR, especially in this context of global pushback? Thank you.
Thank you so much, Chiara. Gracias. Yo voy a hablar en español. Espero que esté bien. Muchas gracias por invitar y por organizar esa sesión. Yo pienso que primero estoy muy feliz de estar acá representando también a Gestus, que es la organización que yo cofundé hace más de 30 años y que ha sido una organización que he avanzado mucho con ese debate de cómo necesitamos hacer con que no solamente los movimientos sociales hablen de sus retos o desafíos o deseos programáticos y los cambios de las políticas, pero necesitamos realmente tener los presupuestos necesarios para hacer con que esas políticas sean implementadas. También me estoy muy contenta de compartir esta sesión con ustedes porque es una de las pocas sesiones de esa conferencia que me parece que vamos a hablar sobre cómo hacer cosas, ¿no? Entonces estamos repitiendo muchas veces que necesitamos cambiar las narrativas, necesitamos cambiar las cosas, pero en final yo he escuchado muy poco cómo cambiar y cómo hacer diferente. Entonces la invitación que hago acá de esa sesión es realmente que aprendamos que la primera cosa que quería decir que vengo de un movimiento de SIDA, que es un movimiento que cuando empezó nos obligó a aprender lo que es salud, ciencia, lo que es T4, T3, cuál es leucocitos, cómo funciona nuestro cuerpo, cuando todos decían que eso era un tema de la ciencia, de los médicos, de las médicas, y que no podríamos hablar sobre eso. Con eso aprendí en Gestus. Y todos sabemos que en las políticas públicas hay dos áreas que son absolutamente cerradas a la participación social. Una área es la área de relaciones externas. Nosotros trabajamos con eso, sabemos cómo es duro meter una posición de la sociedad civil. Y la otra área, sin duda, es la economía. Entonces, hemos aprendido que economía es para economistas, que si no sabemos los rasgones no podemos aportar, y es una mentira. Tenemos que saber y simplificar y saber entender los principios, los preceptos, y así poder estarmos todos y las abogadas por derechos sexuales y reproductivos también capaces de hacer discusiones, inclusive cuestionamientos cuando nos dicen, la salida ahora que la cooperación no está más, es realmente lo financiamiento doméstico. ¿Será? Entonces, muy importante ese análisis que hace Countdown, que muestra que más allá que eso, hay que empezar realmente, primero, cuáles son las oportunidades y segundo, dónde está la plata. Entonces, lo que yo quería mostrar a ustedes hoy primero, en esta primera parte, es lo que es esa idea de tasa sobre transacciones financieras. ¿De qué estamos hablando? Entonces, lo primero es explicar de una manera muy sencilla lo que son los capitales de mercados. ¿Qué estamos hablando cuando estamos hablando de mercados? Entonces, hay un montón de acciones que podemos hacer cuando hablamos de mercado. Hay un montón de instrumentos, herramientas financieras cuando estamos hablando de mercados. Entonces, por ejemplo, tenemos los bonds, que son, voy a mezclar un poco inglés y espagués, porque no sé muchas de las terminologías en español, entonces, pero los bonds que son mucho más lo que emiten los gobiernos en términos de sus títulos, y ahí estamos hablando en un único pedacito de ese capital de mercado que tiene movimentado como en 24, 160 trillones de dólares. El otro que acá a derecha pueden ver son las acciones, ¿no? Que es un mercado que está movimentando ahí como 140 trillones de dólares. Otro ejemplo son los derivativos, que después, si alguien me busca, puedo detallar cada uno. No es mi objetivo, solamente dar una mirada general, pero ahí estamos hablando en la casa de los 800 trillones de dólares solamente en 2024. Y a derecha pueden mirar las criptomonedas, las transacciones de monedas, criptos que año pasado movimentado en la casa de los 3, sí, digamos entre 4 trillones de dólares. Y estas líneas ustedes pueden mirar en términos de lo que es los más estables en términos de inversión y cuáles los más volátiles. Y eso no soy yo que estoy diciendo, esos son los mercados. Entonces, también explicar a ustedes qué estamos hablando cuando hablamos sobre esa arquitectura financiera internacional. Entonces, muchos escuchan decir que en G20 estamos discutiendo la arquitectura financiera internacional. En tal conferencia estamos hablando de eso. Pero ¿qué es esa arquitectura que estamos diciendo que necesita cambiar? Claro que lo que voy a presentar hoy no se trata de una propuesta que vamos a hacer de revolución en términos de que lo que realmente deberíamos hacer es cambiar el capitalismo, que es un sistema exploratorio, es un sistema que ya mostró que está falido. Pero lo que estoy proponiendo acá es una reflexión de no simplemente estar diciendo, vamos a pensar en el futuro, cómo vamos a hacer para cambiar el capitalismo. Es un poco, mientras no cambiamos el capitalismo, ¿qué hacemos con qué tiene el capitalismo y qué nos ofrece? Entonces, esa arquitectura financiera internacional tiene ahí dos grandes instituciones que ustedes conocen, que es el Banco Mundial y la IMF, International Monetary Fund, que son los dos grandes. Después hay las conferencias y los organismos que intentan poner las regulaciones, que son las UNCTAD y la Organización de Comercio. Hay los bancos nacionales y aquí también tenemos un otro actor muy importante que son los bancos de desarrollo públicos, que ahí son pueden ser de multipaíses, pueden ser regionales y hay también los bancos nacionales. Y con esos bancos, en los últimos años hemos hecho un trabajo muy fuerte de mayor alineamiento con las agendas 2030, SDGs, esas cosas, porque entendemos que esos recursos públicos no pueden seguir siendo invertidos en proyectos, sistemas y estructuras que tienen una externalidad negativa y que al final nos dañan los derechos sociales, económicos y ambientales. Y ahí estamos, ahí solamente eso sería para una conferencia entera de cómo podríamos hablar. Y a derecha tenemos los mercados de capitales. Pienso que todos ustedes y todas ya escucharon hablar de la bolsa de Londres, de San Pablo, todas esas bolsas, ¿no? Que hacen las negociaciones de todas ellas son privadas con excepción de Shanghái. Entonces, ahí entro en la parte que quiero realmente que reflejamos es, mira, cuando sumamos todo eso que se pasa en el mercado financiero, las equities, los bonds, los derivativos, todas esas posibilidades, inclusive los cambios de moneda, amigos y amigas, estamos hablando en la casa de cuatrillones de dólares, cuatrillones. Mientras, cuando miramos los sistemas económicos de los países y lo que producen los países, los productos internos brutos sumados, estamos hablando en la casa del año pasado de 111.3 trillones de dólares. O sea, mi mensaje acá es, cuando hacemos esas discusiones sobre financiamiento, estamos siempre diciendo, estamos en una crisis financiera, pero ¿quién está en crisis financiera? Las familias están en deudas, los países están en deudas. La deuda soberana de los países está en la casa de los 110 trillones, muy similar a la GDP global, pero los mercados financieros no están en crisis. En verdad, ellos nunca tuvieron tanto lucro como tiene ahora en ese sistema que es generado, creado para que tengan lucros y para que se aprofundicen las desigualdades. Y cuando decimos hay 1% que tiene 46, 47% de todos los recursos de nuestra región acá en Latinoamérica y Caribe, es de eso que estamos hablando. Entonces, esa es una representación visual para que ustedes miren la diferencia entre capital markets, los mercados de capitales y lo GDP global. Somos 3.7% en relación a los capitales. Entonces, yo quiero decir que sí, que sabemos dónde está la plata que puede venir para nuestros temas sociales y está en el mercado financiero. Pero ahí viene un otro tema que es, esas personas que están negociando en esos mercados no nos van a dar esa plata porque nos van a gustar a nosotros y gustan nuestras agendas. Necesitamos realmente tener un rol fuerte de los estados en la regulación de esos mercados. Todos los países se miran que están en crisis, principalmente los países del sur global. La crisis está en los países y los bancos siguen haciendo los mayores lucros. Es de eso que se trata. Primer punto acá, regulación de los mercados financieros. Entonces, para eso, es decir que los y las economistas expertas, y ese es un debate que viene de muchos años, tajas sobre transacciones financieras realmente vienen de muchos años. El cálculo actual es que si sumásemos, si pusiésemos una pequeña taja sobre transacciones financieras, podríamos tener ahí, de esos cuadrillones, cerca de 250, 300 billones de dólares por año. Y para que les dé la idea, porque yo, por ejemplo, no logro raciocinar en la casa de los cuatrillones. Yo no sé lo que significa cuatrillones de dólares. Es mucha plata, es imposible para mí imaginar, pero si pensamos 250, 350 billones de dólares por año producidos de esas pequeñitas tajas, muy pequeñas, podríamos, por ejemplo, tener solo suficiente para el Fondo Global de las Mujeres, para el VIH-Sida, para el cambio climático, etcétera, etcétera. Entonces, el primero cuestión sería un poco explicar de por qué estamos insistiendo en decir que sí, sabemos dónde está la plata Y acá tengo un montón de plata para dar a ustedes, que pueden buscar conmigo después, pero es por eso que estamos haciendo esa advocacia aquí ahora.
Muchas gracias, Alessandra. Yo creo que nos has abierto los ojos sobre eso. Y sí, el papel de los estados en la regulación de mercados. Sorry, English. Sorry. Yes, so I thank you so much for that point. I have a follow-up question for you. So these financial transaction taxes, as you were saying, I mean, they also have regulatory functions, curbing speculative trading. And could this dual purpose then strengthen our case in terms of advocacy for putting these financial transaction taxes, or do you think it makes them more contentious?
Gracias por esa cuestión. Entonces, porque todos sabemos que esos paneles nosotros acordamos de las cuestiones, ¿no? Entonces, voy para la segunda parte de la presentación, que es contestar a eso. Bueno, no sé cuán familiarizadas están ustedes con Harry Potter, con la saga de Harry Potter. Nosotras feministas somos muy familiarizadas porque somos brujas, entonces las brujas siempre le encanta el mundo de los brujos. Entonces, en Harry Potter hay ese brujo horrible que es Voldemort, que nadie puede le decir el nombre. Y así son las tajas sobre transacciones financieras. ¿Por qué? Justamente porque tiene ese papel de cuando pones una taja, tienes que informar, ese monto tiene que ir sobre un valor y eso lo torna obligatorio, lo hacer más transparente. Entonces, cuando estábamos en pico de la discusión sobre tajas sobre transacciones financieras en los 90 y en los 2000, había más de 40 países que utilizaban tajas sobre transacciones financieras. Ahora tenemos cerca de 26. Es porque, y Brasil, por ejemplo, mi país, tuvimos una sobre cuando había cheques, ¿no? Papeles que escribíamos para pagar las cosas. Y había una taja que había una condicionalidad muy pequeñita para salud y recaudaba mucha plata para el sistema de salud en Brasil. Y todos pensábamos, ay, qué bueno, porque va para la salud, que al final viene para nosotras, y esa taja de repente no pasó más. ¿Y qué pasó? Y nos tomó un tiempo entender que no interesaba a nadie saber cuánto yo utilizaba de plata. O sea, una taja que te hace más transparente la movimentación financiera no interesa a aquellos que quieren seguir y que profiten de ese 1%, ¿no? Entonces, la cuestión es, hay una narrativa hegemónica realmente de que no se puede tocar en los mercados financieros. Entonces, podemos seguir endeudando a los países, debemos seguir poniendo tajas en los productos, en los bienes, en los servicios, pero no el mercado financiero. El mercado financiero se convirtió en un ídolo que nadie lo puede tocar y que los estados calen en esa discusión que es absurda de decir, ay, si ustedes me tajan más, yo voy a salir del país, o sea, no voy más a invertir en tu mercado. No existe eso. Estamos en un sistema financiero globalizado además y el nivel de lucro es muy alto. No pasa mucho si pierde un poco, ¿me explico? Pero estoy hablando acá de una cuestión de ética moral que es muy difícil de convencer a esas personas, y cualquier persona que me diga que el mercado está quedando más sensible porque está más bueno, más, ¿sabe? Ay, somos bons, no me convence. Entonces, ¿por qué los gobiernos siguen con miedo? Y ahí a cada gobierno tenemos diferentes explicaciones, hay un montón de cosas de lavaje de plata, crimen organizado, es muy complejo. Pero a nosotros nos cabe entender ese sistema y empezar a presionar, porque no va a salir sin presión. La tajación es una prerrogativa de soberanía de los países. Y ahí debemos insistir, o sea, ¿a quién vamos realmente elegir para que defienda esas agendas y que defienda las agendas para nuestro pueblo? y cómo construir una posición que explique, que explique cuando vengan esos donantes a decir, ay, no puedo más invertir en la cooperación internacional, pero es hora de los países de sur global, de renta media baja, poner más plata para esas agendas. No es posible, están endeudados, ajustes fiscales, otras prioridades. Mi país, casi mitad de la plata que viene del presupuesto nacional de Brasil es para nuestra deuda interna, no externa, porque ese ya acabamos. Entonces, esa narrativa no convence y es una cuestión política donde invierte. Y desde el G20, año pasado, yo fui la Sherpa de la sociedad civil representando gestos para el grupo de la sociedad civil de G20 en Brasil, que empujó muy fuerte esa nueva tajación sobre los ricos, ¿no? Los más ricos. Y tenemos que hablar sobre tajación progresiva, con eso voy a concluir, Chiara. Si sumamos FTT más tajas sobre las personas más ricas, tenemos ahí 500 billones de dólares por año que podría ser desarrollado, ¿no? Entonces, hay las externalidades positivas. Podemos tocar en la parte de especulación, regular los mercados de capital, los recursos que van para los paraísos fiscales y reducir los débitos públicos. O sea, es posible hacer. Y lo último es un poco decir que esa conversación toda nos tiene que llevar a un otro paradigma. Y un paradigma de que la democracia no es solo política, ella es también, tiene que ser económica. Necesitamos hablar de una economía que sirva a las personas al planeta y no un planeta y personas que son extraídos, explotados para servir a ese mercado económico, con lo cual hemos aprendido no vamos a salir de esas crisis. Entonces, un poco eso que quería decir. Muchas gracias.
Muchas gracias, Alessandra. Thank you so much for this enlightening presentation, and also for bringing in that systemic aspects of economic justice and and the debt justice and debt reform. I think that's it's true if we keep talking about domestic resource mobilization, and of course it can be done in the short term in other ways, but then it's not sustainable if 3 billion people in the world live in countries where the country pays more in debt and actually needs to cut on health, education, and so on. I mean, this is a fact. So, I mean, I think indeed you bring a very important point, and it's really a good connection because now we're going to go to Stella. So the speaker, yes, on the video. So I'm going to introduce her, Dr. Stella Wairimu Bozire. Is a feminist medical doctor, lawyer, and global health leader with several years of experience in advancing gender justice and health equity. And she's the founding executive director of the Africa Center for Health Systems and Gender Justice that advances gender just health and economic systems by catalyzing community-led financing, equipping women with transformative leadership, and amplifying their innovations. So in her video presentation that we will just see now, she will provide us with a critical feminist analysis of debt to health and debt for gender equality swaps. And she will tell us how to advocate for feminist debt restructuring and ensuring SRHR is central into that agenda. So I think we can hear from her.
Good afternoon. My name is Dr. Stella Bosire. I bring you greetings from Kenya. I am sorry I could not be able to join you physically in Bogotá, but this does not remove the opportunity to share with you my findings on debt to health for gender equality. I lead the Africa Center for Health Systems and Gender Justice, a Pan-African institution addressing health inequities and equalities from a gendered lens. Our project, Debt to Health for Gender Equality, was deeply inspired by the urgent need to transform debt relief into a feminist tool for health equity while reclaiming resources from unjust financial systems to fund women's rights, sexual and reproductive health and rights, and gender justice. We know that sovereign debt and gender equality are deeply intertwined, yet global financing systems that exist often ignore this gendered reality. We have used feminist economic models, and health justice lens to reveal how current debt and mechanism sustain inequalities. Using this tool, debt to health for swap framework, we propose a gendered redirection of funding from debt that have been unlocked through relief to fund feminist movements. We are calling for radical shift in debt governance that centers gender equity and accountability and redistributive power. Over the years, the debt within the sub-Saharan Africa has been increasing. We've seen new entrant creditors. We've seen a number of bilateral increase the funds available for the for sub-Saharan African countries to borrow. And yet, with this increase, there has been numerous recorded implication or consequences of debt-driven austerity measures. We have seen a weakening social protection system where these austerity measures erode safety nets such as maternal services, childcare, and social assistance. Women who are often overrepresented in informal and low-paying jobs become more exposed to economic shocks, gender-based violence, deepening structural vulnerability. We've also known that there has been a shift in care responsibility because of austerity measures. When the state cuts funding for healthcare, education, and social services, the unpaid care burden caring for the sick, the elderly, and the children falls disproportionately on women and girls. This unpaid labor, unfortunately, sustains the economy, yet goes unrecognized, reinforcing that women's subordination in both economic and social spheres. There has been a constraint also in women's economic participation due to austerity measures. The consequence of reduced investments in education and health limits women's access to skills, employment, and decent work. With these few opportunities, therefore, income and mobility for women becomes unattainable. Further, this economic model, this constraining also deepens patriarchal control over women because of dependency. We know that the models that exist centralize economic power in male-dominated institutions. Debt governance spaces, from ministries of finance to international creditor, negotiations are often dominated by men and technocrats, and marginalized communities or feminist voices are often excluded. Countries like Zambia saw an increase in maternal death per 100,000 live births that was linked to structural adjustments. We also saw that Zambia diverted large proportions of its budget to debt repayment, leaving minimum funding to address HIV crisis. Mozambique, despite debt relief, under the debt relief models that exist, returned to debt distress as health investments were deprioritized in favor of foreign capital projects. In Kenya, the debt burden has constrained healthcare funding, affecting access to reproductive services and GBV support. Now, the gaps that exist in traditional debt relief frameworks for heavily indebted poor countries, HIPC initiative, the multilateral debt relief initiative, and the debt services suspensions, they're often gender blind. The debt relief frameworks have been built to stabilize economies, not societies. And so they prioritize macroeconomic indicators such as GDP and debt ratio over social outcomes like women's health, education, and social protection. They have never had a requirement around gender tracking, meaning disaggregating the data to see the benefits to ensure that would look at how they are investing in gender transformative sector. We know that these programs have also pushed for structural readjustments, and so cutting public funding to education, push for privatization, and reduced social spending, eroding access to social protection services, while pushing women into unpaid care roles and informal economics. We also know that there are missed opportunities within these models. The freed up fiscal space rarely redirects the funding into SRHR, GBV prevention, or women's economic power. And yet, without gender clauses or accountability mechanisms, These funds often are reabsorbed into the general budgets within the countries, missing these opportunities. Now, these failures to address the structural power imbalances have seen global South majority organizations, and particularly sub-Saharan countries, perpetually in a dependency cycle. And then it fails to challenge the patriarchal logic model of the global financing systems that value fiscal discipline over human rights and economies. Our research proposes a number of opportunities. We propose debt for development swaps, which offers governments a chance to convert debt obligation into social investments, but also a transformative one, where they must be redesigned through a feminist economic justice lens. This feminist model will ensure that freed fiscal space directs funding sectors that reduce gendered poverty and strengthen health equity, particularly around SRHR, gender-based violence, prevention and response, girls' education and economic inclusion, and social protection and care infrastructure. The Paris Club model, the World Bank, the Bridgetown Initiative, all these commitments have a moral policy mandate for creditor countries to align their debt relief mechanism to strengthen the existing interventions that are implemented by feminist and women rights organizations to address gender inequality issues. We know that the 2020 Sustainable Development Agenda commits that all governments, including creditor nations, to finance gender equality and health. And so here is an opportunity for them too. The Beijing +25 Platform for Action also, and the G7 Gender Equality Advisory Council have each reaffirmed that gender equality and equity financing is a shared global obligation. And so we propose that we need to integrate gender transformative approaches into debt relief models to embed these conditions in debt frameworks to ensure that relief prioritizes health, rights, and social protection of women, girls, and marginalized groups. Debt relief needs to adopt feminist models that mandate freed fiscal space to be reinvested into gender equitable healthcare, reproductive rights, and GBV prevention programs. We also propose to institutionalize debt for gender and debt for health swaps that channel funds directly into feminist movements and community-led health equity initiatives. We also propose an advancement of inclusive debt governance, where reform debt negotiations will actually create space and include women's leadership, feminist economies, and civil society to ensure participation, accountability, and decision-making. Finally, to prioritize health, women's health, and SRHR into direct relief models, into direct relief savings that could actually see an increase in funding for universal access to sexual and reproductive health and rights and community-based systems. With this, I see this as a huge opportunity for you and for me and for all feminist and women rights organizations to be able to start pushing back against these unjust systems that deprioritize funding for gender equality. Thank you.
This was amazing. So I'm very happy that, very sorry that she couldn't be here, but very happy that she could share a video. I think it's, I love that we are coming up with solutions. We have solutions. It's just a matter of, advocating for them, convincing the right people to put them in practice. And I think that this feminist analysis of ensuring that debt to health and debt for gender equality swaps are really serving women, feminist movements, communities, and services and SRHR. I think it's a great proposal. Last but not definitely least, we will hear today from Dr. Jan Lacayo. He's a medical doctor and health economist with 25 years of expertise in SRHR and sustainable financing. Dr. Lacayo is UNFPA Global Family Planning Advisor and Health Financing Lead for the UNFPA Supplies, and he spearheaded the development of the new UNFPA Family Planning Strategy 2022-2030 and architected the financing model for the new phase of UNFPA Supply. So I think we couldn't have a better person to, to talk on this panel of this very successful model. So my first question to you, Jan, is UNFPA Supplies Partnership model has clearly catalyzed real financial commitments for family planning. What do you see is the key ingredient of success, and where you as UNFPA Supplies have made this financing model work, where other might not have had the same success? So what was the key thing that you think made it work? Thank you.
Great, thank you so much. Let me take the podium. I have some notes in my laptop, so I'm sorry, I'm gonna leave you a bit for a moment. So I'm incredibly thrilled to be with you. Actually, I've enjoyed a lot your presentations, and I'm so honored to be with such a slow. Okay, let's try. Now it's good. So I was saying I'm really thrilled and honored to be sharing this panel with such an amazing group of speakers. I was not expecting this. I've learned a lot, and I'm really encouraged now with your words and your key messages. I think it aligns very well with what I'm going to talk about right now. So first of all, when I started this, good afternoon. My name is Jan Lakai. I'm a family planning advisor with UNFPA. It's a pleasure to be here with you all. As you know, in Western Central Africa, the promise of universal health access to family planning is fundamental to development and human rights. Yet the region remains one of the most dangerous places in the world to give birth. Yesterday, I was mentioning in a panel presentation that political will is key to move forward on sustainable financing. However, in many cases, the core challenge hasn't been politically will, but the persistent failure to turn the political will into concrete, adequate financing and accountability. This problem is now critical. As global funding for health is under pressure, the reliance on external aid is unsustainable. Domestic resource mobilization is no longer an option, it's an urgency. Today, I'll share how UNFPA Supplies' strategic approach to domestic resource mobilization is turning this challenge around, generating real funding on systemic change. But first, let me share a little bit of what we do in UNFPA Supplies. So UNFPA Supplies works in around 54 countries. It's a global health initiatives that strengthen health systems, work in building better sustainable financing across SRHR and particularly reproductive health commodities. And we're the largest procurer of reproductive health commodities in the world with a budget around of $120 million. I'm gonna go through this first slide very quickly, if you allow me, because I want to focus a little bit more on the second part of the presentation. So for that, we have what we call the domestic financing toolkit. And after trying several years on, improving sustainable financing, we learned that we needed to go to the basics and do the right thing in the right way. So for that, we come up with two main powerful instruments. One is a compact agreement, and the other one is the match fund. We also have some instruments like the bridge fund. We have the health system strengthening, which is pretty much technical assistance we provide to countries in many areas, in from supply chain management to health financing, method expansion, etc. So I'm going to focus right now on two of these main elements. One is the compact agreement, and the other one is the match fund. So the compact agreement is pretty much a document that is signed between UNFPA Supplies and our government partners, particularly the Ministry of Health. But most importantly, we included under this compact agreement the Ministry of Finance. So now they're part of the problem, but also they're part of the solution. And we have also the match fund. The match fund is an instrument that we use to incentivize governments. I'm going to talk a little bit about that later. But I would just like to emphasize that these two mechanisms are not existing in a vacuum. There is a vehicle we use to drive these two across our journey. So let me start with the compact agreement. What is a compact agreement? As I mentioned, is a non-legally binding document that expresses the political commitment from governments into a more formal way. As you know, we've been signing commitments with governments for many years, but these are commitments. These are words somehow expressed publicly, but in many occasions they were not concretized in concrete expenditures, right? So in order for the countries to receive commodities from United suppliers, we apply now a different element, and this is something new from the new phase of the supplies partnership. We applied a requirement of conditionality. So for the countries to receive commodities, they need to meet two criteria. One is to make a minimum domestic financing contribution based on the total amount of commodities we provide to them. Let's say, as an example, if Mali received $1 million, they are required to invest from their domestic funds 1% of that, which is pretty much symbolic. The reason behind is that by doing that, you trigger a series of institutional processes that help governments to be accountable for that. So the second part is to sign an Annex A, which is pretty much aligned with the National Supplies Plan and expresses like where the funding streams, who is funding what, and allow us to quantify the government's commitment in US dollars, right? So we also have the match fund. I'm not going to stop in this instrument, but it's pretty much an incentive we use. So when the country exceeds or maintains their minimum financing requirement or their expenditure, and we validate that is used and spent in quality assured reproductive health commodities, on next year they can apply to the match fund. With pretty much what it does is that multiplies by 2 the minimum financing contribution they did over last year. So that has a profound impact, as Ministry of Finance particularly see that as an opportunity to leverage financing on their own domestic contribution. Okay, so as said a couple of seconds ago, these are two very important elements. And since we established the compact commitments as expression of that political will, which for me is the most important piece of this puzzle, it's like without the political will, we cannot move. We cannot move forward. We cannot do anything. If the government and Ministry of Health, Ministry of Finance, different sectors are not aligned and they're not committed to move this forward, no matter how many incentives, taxes, advocacy we do, we're not going to move forward. So building on that and learning from our previous experiences, we adopted what we call, a model that was, and a methodology that was developed by Johns Hopkins University. It's called the SMART advocacy. It was used for many years by AFP, Advanced Family Planning. So this is a highly structured, results-oriented methodology. This isn't just a generally advocacy. It's a 9-step process focused on achieving specific, measurable, achievable, relevant, and time-bound goals. The real power of this model is in building multi-stakeholder coalitions, and this is critical. It's not UNFPA driving the car. It's the government on the front seat, and then accompanied by several key stakeholders and civil society organizations, the World Bank, GFF, donors, etc., coming together and identifying what are the main goals they have in terms of sustainable financing, and particularly what are critical objectives that it needs to be, as I said, specific, measurable, achievable, relevant, and time-bound. So the real power, as I said, of this model is built in these coalitions. And since July 2023, 19 countries, UNFPA offices across the region have implemented this approach. So let me tell you a bit about what this was. So these coalitions didn't just talk about the problem. They defined highly specific actionable objectives. So we identified 4 common goals emerging across the region, and this is the Western Central Africa region we're talking. The first one is transparency. So creating dedicated budget lines for family planning. If you can't see the money, of course you can track it. So that is one critical element. The second one is adequacy. Simply increasing government spending is not that hard, right? This goal was found across 18 action plans. Efficiency is another element, ensuring that the money already allocated gets fully spent. It's just not allocated, it's not just dispersed sometimes, but actually spent. And this is what we actually match to the match fund incentive. And the fourth one is diversification, mobilizing new money from the private sector through corporate social responsibility. We fell a little bit short on that, and I acknowledge that and recognize that we need to work better and closer with private sector and perhaps build better arguments to have a more compelling case for investing in family planning. But still, there were some minimal progress on that. As you can see on the slide, from the total of 19 countries, we implemented this approach. 17 of them developed action plans, 14 of them signed compact commitments and met these compact commitments, and actually 10 of them unlocked the match fund. So did this work? Actually, the results are quite compelling. By the end of 2024, these focused advocacy efforts helped mobilize around $14 million in new government funding. I'm talking about domestic funding from fiscal funds for family planning across a dozen countries. But the impact goes beyond direct commodity funding. We're seeing deep systemic changes that will last. 4 countries signed new compact commitments, formalizing the government's financial commitments. 4 countries, including Sierra Leone, and at subnational level, Gombe State in Nigeria created a brand new family planning budget line dedicated for commodities. In Ghana and Ebony State in Nigeria, advocacy successfully got family planning, including basic health insurance packages, something we don't see very often. Now, this is where data gets really powerful, right? This isn't theoretical, this is money in the bank. In Nigeria, federal level, I'm gonna put some examples here. I'm gonna talk a bit about other countries, but you can see these additional examples here. In Nigeria, federal level advocacy led to release of $4 million from the government. This was critical because it immediately unlocked additionally $2 million from UNFPA Supplies Match Fund. So this is a perfect example of how domestic advocacy multiplies its own impact. In Ghana, the advocacy target was to secure $1 million. The result, the government procured $5 million worth of family planning commodities in 2024, exceeding the initial target fivefold. In Sierra Leone, and this is a fantastic example of a different kind of win, advocacy didn't just target a family planning item, it targeted the entire health sector share of the national budget. In Togo, we went national. Advocacy efforts target local leaders at the national level, and this resulted in 40 majors pledging to dedicate at least 2% of their municipal budgets to family planning services. So this is a grassroots accountability in action. Now, you can see that over between 2022 and moving forward to 2025, the results I just presented are for 2024 alone. UNFPA Supplies through Match Fund has been able to allocate incentives to 29 countries, and we pretty much exceeded last week this $47 million allocated to Match Fund to a little bit more to $50 million. And you can see now what the critical lessons we have from this experience. The first one is that political will needs to be there. It's not enough just to have instruments, tools, but we need to get political will. And luckily, we have gained that political will through the compact commitments. The second piece is how can we build coalitions that that can move together to advocate in a targeted way to the critical decision makers across the budgetary cycle and the public financial management process. How can we envision that in a way that, without being a financiers, as our colleague mentioned, we don't need to be economists. We just need to understand when and how across the budgetary cycle, decisions are made. And we need to be effective in targeting the people that are making those decisions. This works not only for planning, it works for every single domestic resource mobilization effort. The second thing is that we really need to use the right approach And what I mean the right approach, I've been doing advocacy for domestic resource mobilization. I believe I was doing that for the last 25 years, until I realized I was just being an activist sometimes. And I was communicating and building a lot of evidence on investment cases and different, arguments that I was hoping that magically would be transformed into actions. That doesn't work. What works is using these compelling arguments to get that political will. And once you get that, you use a target and effective advocacy. Hopefully, the smart advocacy work really great with us to concretize that political will into actions that are expressed into budget expenditures. So I think these are the critical lessons learned from this experience. And let me finish my presentation with a short reflection. Almost a year ago, actually almost 11 months ago, Mauricio Catalan, which is a iconoclastic comedian, sold this banana for $6.2 million in New York, right? If invested in family planning and maternal health services in low and middle income countries, that could have saved the lives of 520 women and girls. So when we as a civilization understand that the value of women's lives are more important than a banana, we will take a break. For a moment, we'll continue working. Thank you so much.
It's okay. I have to. Thank you. Thank you so much, Jan. I think that was very inspiring and very good to see that the smart advocacy methodology works. And I think that, it really gives hope, all of those numbers that you put there. And I think it's really great to see that you were able to translate all those commitments in real budget allocation. And so thank you so much. I think I'm now turning to the audience. Thanks to all the speakers. We started a bit later, so we can take maybe 10 minutes if there are questions. Yes.
Hi, everyone. Thank you. I agree with Alessandro. It's really nice to hear some of the how behind some of the crazy conversations that we've been having this past week. My name is Annie. I'm a co-founder of a startup looking at women's health here. And my question is inspired by something that Dr. Yan just said, but I'd love to open it to all of you. I'm curious how you communicate to private sector companies what the return on investment can be from working on women's health and from something that has historically been seen more as a charitable donation. Thank you.
You want me to answer? Okay. No, thank you very much. That's a critical question. And I was right here yesterday talking about failures on a panel on personal failures. And that for me has been a personal failure. Working with private sector is not easy. And we've been trying to, implement different approaches. One of them is a total market approach. And that started probably more than 10, 14 years ago. And we cannot adopt that approach within UNFPA and, of course, different partners. The idea behind that is to, identify different segments of the population that, can be served by different, providers. In this case, like public sector can serve the lowest quintile of the population, and we focus and target our efforts on that. We as UNFPA, as a government partner, we usually focus on that quintile. While at the same time, we try to advocate with the governments to remove, or not remove, but clarify, the policy framework for the private sector to engage in, in the procurement and distribution of contraceptives, sometimes through social marketing, sometimes, through retail. And I think by, making clear that there is a niche in a market segment they can clearly serve, right, which is the highest quintile, the people that, and women and girls that have the ability and the capacity to pay and the willingness to pay as well to get quality assured contraceptives or reproductive commodities, then they see the opportunity. And as long as the government has a very clear framework on that regulates that process and helps different providers, whether these are like public sector providers, social marketing organizations, or commercial and retail players, they will immediately engage. It's not as providing them incentives. As long as they understand that the rules are clear, they will engage. Now, our role as UNFPA, as a UN organization, is very focused on supporting government counterparts, right? But we also work with different partners that are critically engaged with private sector. We work with market shaping initiatives, trying to expand the method mix, but also guaranteeing the availability and accessibility of different reproductive health commodities at lower prices, for certain population targets. So this is pretty much what we do with the private sector. Of course, there are health insurance schemes we work. There are other instruments we use and engage with private sector. But I think centrally, this is total market approach is one of the main vehicles we use.
Are there other?
Hola, soy Xiomara Molina de Chile. Vengo de un país que dentro de la OCDE es el más desigual, es el país con mayores niveles de desigualdad. Tenemos un ingreso mínimo de $500 aproximadamente. El presidente anterior que tuvimos era un millonario, Piñera. Digo todo esto porque normalmente mi país está clasificado como un país de altos ingresos. Y eso es un desastre para quienes estamos en los movimientos sociales, en la sociedad civil. Entonces, escuchaba no recuerdo tu nombre, disculpa, de ICFP, y claro, si el foco está en en comprender cuál es la narrativa, en comprender cómo funcionan los procesos para ver desde dónde podemos abordarlo, mientras tanto echamos abajo el capitalismo, ¿cómo lo están viendo ustedes? ¿Cómo se traduce eso en la práctica? ¿Qué han visto como posibilidades de avances en esa materia? Porque mientras tanto se nos va pasando el tiempo. Gracias.
No, súper gracias. Yo pienso que es muy difícil porque el poder del mercado financiero es muy grande. Todavía es importante entender que todos estamos en el mercado financiero, o sea, los fondos de pensiones, nuestras platas que salvamos, todo es parte del mercado financiero, el gobierno, todo eso está en el mercado financiero. Entonces, me parece que el primer paso sería tener más conversaciones sobre esas y poder tener una construcción de educación económica para que nosotros, que somos tan expertas y capaces de entender los sistemas de todo lo que necesitamos en términos de salud, derechos sexuales y reproductivos, podamos también usar nuestra energía para ese campo y sumar nuestras agendas con los grupos que ya están discutiendo aspectos en relación a las deudas, bueno, todo que hemos avanzado en términos de las conferencias últimas, ¿no?, que hemos participado. Pero también me parece importante que necesitamos hacer eso de una narrativa diferente, porque entiendo también que los movimientos sociales han de alguna manera endemonizado el sector privado, que no es correcto, porque nuestra estructura social es compuesta por la sociedad civil, por los y las que produzcan, por el sector privado, por los gobiernos. Y ahí viene la cuestión de las regulaciones. ¿Y cómo podemos avanzar para regular? Y ahí yo estoy totalmente de acuerdo, todos estamos, ¿no?, que necesitamos de voluntad política, pero la pregunta es, ¿cómo hacer que haga voluntad política? Y ahí volvemos otra vez, necesitamos un movimiento de la sociedad civil fuerte que con evidencias pueda hacer una presión suficiente en los parlamentarios y parlamentarias, en los gobiernos, en quien toman las decisiones, y armar una mesa de concertación con esos grupos, con todos, y mostrar cuál es el impacto de seguir con ese modelo. De misma manera como hacemos esas demostraciones de cuál es el impacto de no invertir en derechos sexuales y reproductivos. Porque, claro, no invertimos ahora y pagamos mucho más adelante. El costo es mucho mayor. Entonces, tenemos en ese momento que no cerrar las puertas al diálogo y pensar qué instrumentos, herramientas financieras nos pueden ayudar a tener algo que es muy importante para los movimientos y para las políticas de planeamiento familiar y derechos como un todo, que es estabilidad de inversión. Tenemos que salir de una estructura de ayuda al desarrollo, de financiamiento que es voluntario para algo que sea regulado y consistente. Pero eso no va a pasar si nosotras que somos tan fuertes en estas agendas de derechos seguimos aún muy lejos de esas discusiones de financiamiento.
Do you want to add something to it? I have a question. Yes, good afternoon, everyone. My name is Demilade Oshotek from Nigeria. I work for the Solina Center for International Development and Research. My question is around using financial markets and government bonds as a way of raising funding for family planning. It's a coincidence that a lot of the countries who need this family planning financing the most also have the least developed financial markets. So they don't have a stock exchange just when it comes to domestic resource mobilization. They don't have a well-developed stock exchange market. They don't have bonds that are very mature. So the financial transaction tax from that perspective becomes a little difficult. And I think that they are the really low-hanging fruits. If the countries that need these resources already demonstrate that they are generating it by taxing their own capital markets or government bonds, then it signals to richer countries with more advanced markets that these kinds of taxes or financial transaction taxes can happen. So how should countries, so my question is, how should countries with poorly or underdeveloped financial markets key into this opportunity that is clearly laudable, but maybe out of reach for them? I think that's the first question. Second question is really around the taxation in other areas. So some kind of sin taxes to fund this. Which other areas can be looked into, especially for countries where it's austerity measure right now and additional taxation will push people to the edge because they are currently even struggling to make ends meet? Thank you.
No. Beginning for the second question, I think that what we want to make clear is that we are not talking about more tax on the people. We are talking about taxation that are progressive, meaning that those who win more should pay more. And we are talking also about taxations where the products that are sold could, for instance, damage the health of people, that could, that kind of taxations. Essentially, it's important to all countries, independent of reach or not reach or whatever their status, to make sure that they have progressive taxation as a principle, as a baseline, so they can start creating this culture of justice in economic, and we can move on with that. In terms of the markets, also, it doesn't matter the size of the market or how developed is or not developed, because something that changed also from the past, when we start this conversation around FTTs, there was, the first block was, we will never have all countries agree with that. And for some years, we struggled to put forward a model where all countries could participate and collaborate. Then somehow we discovered, no, perhaps it's not necessary to have all countries on board. You can start with groups of countries. And at some point, people said, no, this is not going to happen. And now we see in the trade area, we see that with the impositions of the US on trade markets recently, obliged the countries to come together and to navigate, leaving the US outside. Even the discussions around the dollar being the principal coin in the basket of the currency basket, it's changing, things are changing. So in the times of crisis, in the times of this kind of desperation, this is exactly the moment for us to start discussing. There are solutions, and there are plenty of solutions, but we need to increase the pressure, and just to finish, increase the pressure on the governments from the north, who was those blocking, the advance of these conversations.
Thank you. Thank you so much. Thanks for the questions. Thanks to the panelists. I think we are concluding. We are over time, and I see people coming for another. But I just want to say, to conclude, that, yeah, we've talked about a lot of things. I'm not going to repeat. But I think if I invite you, once you leave the room, to really think for yourself, what can I do? Be policy, advocacy, or whatever, partnerships. What can I do to make, innovative financing for SRHR a reality in my context, in my role? I think that this is really something that we need to work together. It will not be one sector or one actor to change. We need to really work together, and all of us, it depends on all of us.